the World Health Organization has announced a few days ago that the COVID-19 does no longer constitute a public health emergency of international concern. As the government of South Africa, we want to emphasize and clarify that that does not mean the pandemic is over, meaning that the people who feel that they are vulnerable, especially the elderly and those who are living with comorbidities like your HIV, TB, diabetes, and others, should feel free to come to our vaccination sites, which are mainly accessible at our primary health facilities, which are clinics and also some of the hospitals, and get these life-saving jabs.
So you are still encouraging people to vaccinate. I mean, some of the challenges that we have seen of late were people who were coming forward with what they said were complications as a result of vaccinations. And this was also impeding the public education drive on the importance of saying, get vaccinated, get a booster shot. Please continue to also observe the protocols that were already in place to stop the general spread of infection and viral diseases. So where are we with that? Are you gaining confidence with people to say it's still safe, even though some people have complained of certain complications?
Definitely, as much as we all agree that the country we might have reached what we call the population immunity, because majority of South Africans have vaccinated. I think about just above 25.5 million people have received one dose. So yes, we want to encourage people to say, please continue, because the World Health Organization never said the pandemic is over. So they just said it's no longer a public health emergency of international concern, meaning that we must continuously feel free to support those who want to vaccinate, especially those who want to come forward for booster shots, to feel free to access this live jab, because the pandemic is not yet over. We receive calls on a daily basis from people, especially those who feel vulnerable, who feel they are at risk, who are asking for where can they get vaccinated, where can they get the booster shots, and we continuously encourage them to go to our nearest facility to vaccinate. And also people test positive on a daily basis, as much as they don't come in numbers, but people do tell us from time to time, say, I'm exhibiting COVID-19 signs and symptoms, and to show that this is still, for many people, they still feel the COVID-19 is still that scary disease. So we encourage people to say, please feel free to come to our sites, our health facilities, as they go to consult for other health conditions. When they go for regular health screenings, they must also feel free to take this life-saving jab, because the World Organization did not say the pandemic is over. So we say, as the government will continuously integrate vaccination services into our primary routine health services.
I'm still going to go back to this issue, Foster, because I do think it's important, especially for people who feel that as much as it's a life-saving drug, they're protecting themselves. There are people who believe that they could still be spared because they don't have, for instance, comorbidities. The W.H.O saying the CDC has approved a new COVID-19 booster shot as well. Explaining some of the scientific data developments, even the fact that we still don't know where this originated from, how much does it complicate that drive?
Definitely, that is the data that we are also looking to receive from the scientists from W.H.O and other entities working in the health sector, especially the epidemiologists, as far as the origin of this virus. So, but what we can do for now, while we're still trying to get as much as information as possible, our role is to empower our people with health information in order to make well-informed health choices.
So we're saying the global health crisis is over, but it does not mean that people are still or are free from COVID-19. In fact, we know, I certainly personally know of people who have, even as we speak in this day and age, being afflicted with COVID-19 infection. What are the figures? Are there provinces that are still more vulnerable than others?
Yes, in terms of, remember our target population as a country for adult population, it was about 39, just almost 39 million people, but we've managed to reach over 25.5 million people with at least one dose. Out of that 25.5 million, at least 19.4 million fully vaccinated. But also remember that we also introduced the booster shots, and about 4.3 million people have received these booster shots. That shows that the people really felt they're vulnerable. They came forward in numbers. And also we also introduced additional booster dose for those who are immunocompromised. And I can confirm that almost 25,000 of those who felt they were immunocompromised, they came forward. So we feel that we have done enough, but that does not mean this is the end of the war, of the fight against this deadly virus.
I mean, at the time when we were on high alert and all of our public health systems were geared towards keeping down the numbers, when we had some sort of stranglehold on protection, we're going into the winter season and we know that COVID-19 flu-like systems, but by then our public health facilities were geared towards that. If you need to be vaccinated, to get a booster shot, sometimes if you need to get tested. Are those still in place?
Yes, definitely. In fact, I'm going to also to clarify and educate your viewers that as we indicated that we've introduced more booster shots, we said people aged 50 years and older are eligible for 5 doses, including 2 primary vaccination doses, meaning that they get 2 doses, which are primary doses for them to be fully vaccinated, and 3 additional doses. Then people who are aged between 18 and 49 years are eligible for 4 doses, meaning that 2 doses for fully vaccination plus 2 additional doses, while children aged 12 to 17 years old, for now they're still eligible for 2 doses of Pfizer vaccine, not J&J.
And when the department looks at what it has achieved and what it needs to improve on, the health systems, strengthening them at the moment to prevent other possible public health scares, what are the areas of concerns or priority when you look at it at the moment? We were just speaking about the situation at Doranginza in the Eastern Cape. If we're saying that there is still COVID-19 or other even diseases that can be spread from being in enclosed spaces with a great number of people, what are you doing about it?
Definitely. In fact, this topic comes a few days after the second presidential health summit, which was convened by the President Ramaphosa to track the progress made with regards to the implementation of the interventions that were recommended in 2018. Although the summit did admit that some of these recommendations could not be fully implemented precisely because of COVID-19, which was very disruptive in nature. So, yes, there are a lot of areas that needs to be looked at. One of those is the issue of infrastructure, which needs to be upgraded. As we know that majority of our health facilities, they are not in a good state or in good condition. So these are some of the issues that needs to be looked at, but also some of the issues, of course, the issue of medical legal claims. As we know that the Department of Health is one of the targets by lawyers and others with regards to medical legal claims. So we need to strengthen our systems in order to close all the gaps that leads to medical legal claims. But one other issue is also, as we've indicated, that our health promotion, we need to intensify our awareness campaigns as part of our preventative methods instead of curative method, because we need to empower our people with health information in order to make well-informed choices. Just now, we in the country, especially in Gauteng, we remember that there was an outbreak of cholera, where about 11 cases were confirmed, all in Gauteng in the 2 districts. So we have done enough in order to raise awareness about cholera, and people, they heeded our calls. We said don't drink water from sources that we cannot guarantee the safety of the water, and they heeded our call. That's why today we're still sitting with about 11 cases of cholera, and all those people who tested positive, apart from 2, were passed on, but the rest, they managed to recover because we continuously intensify our health awareness campaigns in those areas, but also across the country.